Hi, my name is Dr. Mark Leader, and I'm a pediatric emergency medicine physician at Nationwide Children's Hospital in Columbus, Ohio. And today I'm working with my friend and colleague, James Robinson. James is a orthopedic and suture tech here at Nationwide Children's and works in our urgent cares and emergency department. We are going to be reviewing with you today many different types of splints. We're going to start out with splinting of the upper extremities, and in a later video we're going to show you how to splint lower extremity injuries. And these are splints that you can use in your own office. If you see a patient in the community that happens to come to your practice and presents with an injury, we are going to show you how to stabilize those injuries and make the patient comfortable and get them to the appropriate place for their definitive care. We're going to be showing you the application of the long arm posterior splint today, and this is a splint that you can use for upper extremity injuries in your own primary care offices to stabilize fractures and then disposition the patient to either a hospital setting or home with orthopedic follow-up. Most of the time we are using the long arm posterior splint for injuries of the proximal radius ulnar and above. You can use them as well for the distal radius fracture or fractures in the wrist region, but for this we tend to use a sugar tonic splint, which we are going to show you the application of as well. For the long arm posterior splint, the most common fracture type that we will be using this for is the supracondylar fracture of the distal humerus. Now remember, those fractures, there's typically three different types with the grading type 1, type 2, type 3. Type 3 is the most significant fracture type. Type 1 is sometimes very subtle or oftentimes referred to as an occult fracture of the distal humerus. So a type 1 supracondylar fracture, distal humerus, you see a patient, injures their elbow, you order an x-ray, and the report may come back, elbow effusion noted, visible posterior fat pad. That should clue you in that that patient may have the type 1 supracondylar fracture pattern, an occult fracture through the distal humerus, requiring splinting and orthopedic follow-up. The type 2 fracture would be in the same place, but the distal fracture piece is angulated but still attached to the humerus. And the type 3 supracondylar fracture, the distal humeral fracture piece is angulated, displaced, and not attached to the proximal humerus. The most common type to your average 5, 6, 7-year-old child who falls from the monkey bars on an outstretched hand will be the type 1 supracondylar fracture, and you can splint those in the office using the long arm posterior splint, which James is going to show how to apply right now.
Alrighty, the materials. You actually need 4 things to apply the splint. You actually will need your orthoglass splint material, which comes from size 1 inch to 4 inch, sometimes 5, depending on the size population of patients that you treat. You will also need a cotton soft roll called web roll. This is another layer of soft roll that will protect the patient's skin from rubbing of the splint. You will need a stocking net. When applying this, and you will see in a minute, will create a bumper that helps protect the patient's skin as well. And of course you will need a strap. This will secure the whole splint to the extremity, so of course it stays on the patient's body. Now, the stockinette comes from 1 inch to 5. The web roll comes from 2 inch to 4. And of course, if you want to cut these, you will need a good pair of scissors. Alright, so now we're going to apply the splint. First, you need to apply your stockinette first. Okay? You need one portion to the proximal end of the arm, and we're going to apply one to the distal end. Proximal end goes first. So you're going to lighten it. You're going to slip this all the way up. High humerus, high as you can go. Okay? The second piece, you're going to want to place a hole for the thumb. just by cutting it with a pair of scissors. You're going to open it wide. You're going to instruct the patient to put their thumb through the hole and their fingers go through the rest of the portion. Alright, now this is where you need to position your patient. Their elbow has to gently come at a 90 degree. Okay? Alright. And when you're done with the splint, they're going to actually be in this position. Okay? Alright, so now what we need to do, we need to apply our web rope. I usually create a hole, slip that over the thumb, come around, apply again, another hole. Now keep in mind, guys, your patient will have an injury, so you want to apply this very gently, okay? One more, come around about 3 times, come under the thumb, and go down by half now. All the way, and you can adjust your web roll, smooth it out as you go.
So when James says half, he means half the diameter of the roll that he's using with each wrap.
So now when you reach the approximate end of the humerus, go around 3 to 4 times, staying in the same track, creating a nice soft bumper. Okay? Now you want to pad the elbow. It's extremely important that you take strips of your web roll and you add these extra strips to your patient's elbow. This will prevent any rubbing or a chance of a pressure ulcer. Okay, now that we have him all web rolled, you're going to pull this down. Now you have a nice soft bumper. And you're going to create the same thing up top here. You want to cut another hole, just a small one, again for his thumb. Okay, bring this down, bring the thumb through, gently just tug on it, creating the bumper again. Okay, this is where I actually have my patient relax a little bit and just wipe. Now you need to cut your orthoglass. Never pre-cut your orthoglass because it will dry out on you. So always cut after you've applied your stockinette and your web rope. Okay, so you're going to want to measure. You can measure in several different ways. You can take an actual measuring tape and measure. Some people will take another piece of web rope and string it like so. And this will give you an idea of how much orthoglass material you actually will need to cut. So that gives me a very good idea. If you have a tape measure in your office, you can use a tape measure. Okay. So just gently bring this out. Lay this on top of your web rope, your orthoglass. This is the general area about how much I need. If you cut more, that's fine. You can always cut it down to fit your patient, okay? All right. After cutting your orthoglass, I'm going to come to my patient and remeasure. You want to measure from the metacarpal joint all the way up to just below the bumper that you created. So this is the amount I need. So I have an extra. I'm going to trim that down. And what you would want to do, you have a seamed opening on this side of your orthoglass. You can open it up and trim those nice sharp little shards that you do not want to touch the patient. Pull your web rope over your orthoglass so it's all covered. Do both ends the same way. As these harden, they will become like little needles, and they can actually penetrate the skin of your patient, and you would not want that. So, you would go to the sink and you would wet this. One side. And that's perfect. Okay, and just wring it out. So now we're going to apply it. And there's no need to do both sides. You just need to wet one side of the orthoglass. So you bring your patient back up. And you want to start from the ulnar side. Do not start from your volar side or your dorsal side. You want to actually gutter it on the ulnar side like so. To make it easy for you, once you do that, take your ace wrap. And I want you to secure the wrist like so. If you have an extra pair of hands, that's great. Sometimes you will not. Now you want to work yourself back up to his thumb space. I'm going to have Dr. Leader hold his fingers right here. When you get there, just take your ace wrap, pinch it, gently like that, and come through. Come right down, and continue to wrap again by half, as Dr. Leader explained earlier.
James, I've noticed when I walk in the room and I see you putting a splint on, you usually take advantage of this time to tell the patient how to care for the splint at home.
Absolutely.
What do you usually tell them?
I usually start out by saying, do not get it wet and do not remove it. If you get it wet, the web roll that we have placed on his arm will actually get wet and lay against the patient's skin and can cause some skin breakdown. So, just like a regular cast, these splints cannot get wet. Okay? They have to stay dry. Now once you get him secure, you make sure he's at a 90 degree, and they usually leave out with either an arm sling or what we personally at Nationwide Children's call cuff and a collar, but an arm sling is fine. Okay? They cannot get this wet. They cannot take this off. They should check cap refill on a regular basis to make sure they have proper blood flow at the distal end of their arms. They should return immediately if they're not immediately being seen. If they have tingling, numbness, uncontrolled pain, those are things that should be seen or treated immediately. And this is what we give them as homegoing instructions. Okay.
Yes, so at this point, if you're with your patient in your office practice, dependent on the nature of the fracture that you just splinted, you are either going to send that patient to an emergency department for definitive care that evening, or you may be referring them to your local orthopedist to see them in their own office in the next 3 to 5 days typically. There you have the application of the long arm posterior splint.